A report commissioned by the World Health Organization has revealed that one of the deadliest diseases on the planet is malaria, and it can be eradicated by 2050. According to the research team made up of 41 leading scientists, economists, and health policy experts, it will be possible if there is a concerted effort to ensure a strict adherence to the policy findings. Malaria has been a major cause of poverty and low productivity, accounting for about 32.5% of all OPD attendance and 48.8% of under 5-year admissions in the country. This is according to the National Malaria Control Program. My colleague Hannah Odame from the Health Desk had a conversation with the Deputy Programs Manager of the National Malaria Control Program, Dr. Kizia Mao.
I wasn't too surprised because being in the malaria field, we've had a lot of discussions. In fact, even as a country, we had commissioned a study to see the feasibility of reaching elimination, or what our current interventions will get us to. And just yesterday we looked at the results of that study. So it's all moving in the same direction.
Okay, then give us some leads into that report that you commissioned.
I'm sure we'll disseminate that much more later. But what we saw was that if we continue doing, with the interventions that we've been doing, we've seen a decrease in the number of deaths. Admission is going down slightly, but the number of cases are still very high. That's why malaria accounts for the highest proportion of OPD attendance. So what we've seen is that if we continue that way, by 2030, we'll still be seeing millions of malaria cases in our OPD. Deaths may go down as we've been seeing, but we'll still be seeing very high numbers of malaria. And however, moving towards the elimination goal is possible. The studies show that it's possible. It just needs more acceleration. It needs intensification of our existing interventions. So we would have to increase the coverage, geographical coverage of indoor residual spraying to what we had intended in our strategic plan. That is making sure that it goes all the way to Kafa Bronga Hafo, making sure that people sleep in the nets, and also getting people to access health care as quickly as possible. So when they go to the health facilities, we have to make sure that those taking care of them are properly trained, they have the right diagnostic kits, they have the medicines to give to the people. And with that, the modeling and the modeling that we did showed that it is possible for Ghana to reach pre-elimination figures by 2030. But that is a daunting task.
That's 2030 for Ghana, 20 years ahead of what the WHO is saying. We have about how many years? About 11 years to 2030. And you're sure that these measures, if you should continue and improve upon them, we will get there?
So if you look at the WHO report it says that some countries can get there by 2030. So we looked at the 2030 figure because that was what the African region had aimed to, that as they were trying to encourage countries to work towards 2030, so that by 2030, quite a proportion of the African country will be free of malaria. Like I said, it's possible, but it demands a lot of mobilization of resources to make sure that we up the game. Otherwise, we are going to see gradual reductions.